I want to address the issue of GPs not seeing their patients. All credit to Sajid Javid, the Health Secretary, for actually calling time on GPs choosing to do far too many online appointments, Zoom appointments, phone appointments, and not seeing their patients face to face. Yes, for many of us, it's an absolute bonus, isn't it? Not having to call up and schlep to the surgery during working hours to get an appointment just to get a prescription. That's great news. But for millions of patients, it's absolutely vital that they see their doctor face to face and that they see the same doctor again and again if they've got chronic and multiple problems. And I'm afraid that's far too many of us in this country. If patients can't see their GP, we know what happens. They either go to A&E, and we're already seeing a casualty overwhelmed by that, or worse, they don't see a doctor at all. And during the first lockdown, we know millions of people who would normally have seen a GP with concerns about heart disease, cancer, or many other problems did not see a doctor at all. And as a result of that, thousands of those people will die. That is the reality of GPs not doing their job properly. I'm sorry, being a GP is not a lifestyle choice. It's not a part-time job. It's a vocation, not a hobby. It is time that GPs got back to doing the job properly. And doing the job properly involves seeing every single patient who wants to see you face to face in your surgery face to face. If you don't want to be around people, maybe medicine was the wrong choice of job for you. Right, well, let's get to Dr. Richard Vaughtry. He's chair of the British Medical Association GPs Committee and joins us now. Good morning to you, Richard.
Good morning.
Thank you very much for joining us. Well, we're told that GP surgeries are going to be named and shamed if they fail to deliver enough face-to-face appointments as part of this, we're told, major NHS drive to improve access for patients. The government's unveiling a blueprint that includes an extra £250 million for general practice to increase capacity over this winter, to hire more staff and the like. I'm not entirely sure that £250 million is going to touch the size of this problem, but why aren't GPs seeing enough of their patients face to face right now? What is the crux of the issue?
Well, GPs and their practice teams are working as hard as they possibly can, seeing more patients than ever before, consulting with more patients, both by telephone and by face-to-face appointments whenever it's necessary to do so. But we have been limited by the requirements for social distancing, so, for infection protection control. We can't have as many people in our waiting rooms as we used to do, because the last thing we want is patients sat in a waiting room waiting for an appointment and to pick up an infection from someone they're sitting next to, and then leaving with that infection as a result of coming into the surgery. So we have been working to protect our patients. We want to see more patients face to face.